Next slide. So just to start with, what is monkeypox? So it's a viral infection. It's very similar to smallpox, but is generally much less severe. It's spread by intimate contact, mostly skin to skin. It can be in bodily fluids as well. So there's evidence that kissing and other types of exchange of fluids can also transmit monkeypox. It can also be transmitted through air and respiratory droplets. This is thought to be a much less common way that it can be transmitted. And then it can also be transmitted through fomites. So that's the virus being present on towels, bedding, and those kinds of things. Again, that's a much less common way that it can be transmitted. There's many of the cases that are now happening in this outbreak, and I'm sorry, I'm not sure why MSM is in much bigger font, but this current outbreak is focused, has been predominantly among MSM. And at the bottom, you can see a timeline. This is not a new virus. It's behaving in new ways, in the ways that we're identifying in this outbreak. But it was first identified in the late 1950s. There have been outbreaks since then. There was one in Wisconsin in 2003, and there were some traveler cases in 2021. But this current outbreak is much larger than those prior outbreaks. Next slide. What does monkeypox look like? It generally causes a rash and something that we refer to as lesions. These are bumps that can be in areas where either someone is exposed or there's something called auto-inoculation. If somebody has a monkeypox lesion and touches it and then touches another part of their body, that can actually cause the lesions to develop in that area. We're seeing them sort of all over in terms of locations, the face, the hands, the feet, and they generally last about 2 to 4 weeks. They're often preceded by flu-like symptoms. We call it a prodrome. These are also, as you probably recognize, many of these symptoms are very similar to COVID. So fever, headache, muscle aches, generally mild, and generally resolves on its own. There are some severe cases, however, that have required treatment, and we've treated several people in San Francisco for more severe cases of monkeypox. Next slide. So just a bit about the current outbreak. I updated this today. So as of 2 p.m. This afternoon, there are over 10,000 cases. I looked at these data yesterday, and it was about 800 and something cases. There are now 929 in the US. California has 136. And San Francisco has 60 cases as of today. The data were updated. Most of these cases have not been in people who have traveled. So these are transmissions that are occurring in our communities. Next slide. There's a common question we get about testing for monkeypox if somebody has an exposure or an exposure notification. So generally the approach to monkeypox is if somebody has been exposed or has a risk for an exposure and then has a rash that can be swabbed. So the current way that we're diagnosing monkeypox is via swabbing the lesions. And so we generally try to collect 2 swabs from each lesion. And ideally we'll collect it from at least 2 lesions. And then we send the samples to the state lab or to our local lab, and then they get sent to the state lab where they're tested. And if they're positive for the type of virus that monkeypox is, then they get sent to CDC for confirmation. Thankfully, there's been some changes in lab availability. So now commercial labs and local labs are now expanding testing capacity. So we should have more access to testing for monkeypox soon.
Dr. Scott, can you pause just 1 second? We're having some issues, it sounds like, with the Spanish translation. So we're attempting to fix that. 1 second, please. While we work on fixing the Spanish translation, again, if we are seeing that many of you are asking questions in the Q&A, please continue to do that, and we will try to get to as many questions as possible. We apologize for the technical issues that we're having. We're trying to fix those currently. Thank you for your patience. Dr. Scott, why don't you go ahead and continue?
Okay, great. Thanks, Russell. The current status of testing has been that it's been pretty slow more recently because the volume of testing has increased, and Jorge will talk a little bit about what we're seeing at Strut. But now LabCorp and other local labs, including our local lab here in San Francisco, are bringing new testing online. So that should hopefully increase capacity. All right, next slide. So I just wanted to touch on stigma, that, that this, there's been a concern about the stigmatizing language that is being occasionally used for monkeypox and the impact within our communities. And so there is careful attention being paid to this, and hopefully soon that the name will change, and we're trying to ensure that our language is not stigmatizing, is positive, sex positive with the communities that that are experiencing this outbreak. And so we'll talk a little bit about our approaches and how we're responding to this outbreak locally and well as in California and in the US. So next slide. So I'm going to turn it over to Jorge for talking about the SFAF response.
Thank you, Dr. Scott. So yeah, how have we responded at the San Francisco AIDS Foundation? First and foremost, I want to say that we've responded as quickly and as agilely as we could, trying to respond to the demand from the community. We've also been in close coordination with the San Francisco Department of Public Health and other agencies like San Francisco City Clinic. We really couldn't do all of this without their support and help. San Francisco AIDS Foundation is one of only 3 sites at the moment that it's offering testing and vaccinations, and hope that that will expand very soon. We really quickly dedicated a hotline specifically to the monkeypox questions and inquiries that have been coming in. On one day, we had over 500 inquiries. So ask for your patience on that. Definitely getting a really strong demand of requests coming in through that phone line. Currently, we have a wait list of over 2,000 people at last I checked for individuals who are eligible and interested in the monkeypox vaccination. Last week, we saw an average of about 2 to 3 suspected cases daily. We currently are in process of 26 current suspected cases. We've only at this point, so this touches a little bit on what Dr. Scott mentioned, received about 10 results of those 26, 8 that have come back preliminarily positive, and still waiting for a large majority of those results, of which we hope to get very soon. We also have been educating the public, so we've done a lot of information, sending out information in all sorts of avenues, responding to media requests, social media requests, and informing the public where we can. And finally, we have been providing doses of the vaccine, and I'll talk about that in just a moment. The Jynneos vaccine. So far, we've been supplied about 290 doses. That's as of last week, July 6th. and we have an upcoming scheduled vaccine event that we hope to provide vaccines for 500 individuals. We'll talk a little bit more about that. That's definitely not near the demand or meeting the demand we understand of the community, but we are doing our best to get there as quickly as possible. Oh, I forgot to mention, we're also partnering with the CDC as part of a study to enroll 100 clients in a nationwide seroprevalence study. So really just to take a snapshot of how much monkeypox is out there in the community and comparing that over time. Next slide, please. So Jynneos, a lot of information's been out there about the vaccine. Jynneos is the FDA approved vaccination that's recommended at this time for post-exposure prophylaxis. Theoretically, if somebody was exposed to monkeypox, it would decrease the risk of progressive infection. Right now, we are recommending that only for asymptomatic individuals, so people who are not yet showing symptoms of monkeypox, some of the symptoms that Dr. Scott alluded to earlier. Currently, the eligibility requirements in San Francisco County are people who have been referred by a contact investigator or a close contact of someone who has monkeypox, and that's either suspected or confirmed. We also are taking people who are self-reporting a close contact. So if a partner notified somebody, hey, you might have been exposed to monkeypox, we were together, we're also accepting that as a potential eligibility. We also know that if you've received a notification from a large party, for example, during Pride, multiple events have blasted out messages about potential exposure. That's also qualifying somebody as eligible for the vaccine. And then finally, healthcare workers. And there are specific guidelines on which healthcare workers are eligible. At this time, it's laboratory workers or clinicians who are at high risk for occupational exposure. Next slide, please. So I think a lot of people are asking about this. What do I do if I'm exposed? So first and foremost, seeking out the vaccine. We recognize that's a hard message to put out there when there's still not quite the supply meeting the demand, but if you can, if you've been in close contact or you've been notified, there are ways to reach out either through the San Francisco AIDS Foundation and other resources. Also monitoring for symptoms. So some of the symptoms that Dr. Scott mentioned before, again, that initial flu-like symptom followed by a rash that doesn't seem to be explained in other ways are really important to take note of. If you are concerned about monkeypox, it's a really good idea to let your partners know if you feel comfortable doing so, and then limiting close physical contact if you are determined to have monkeypox or highly suspected to have monkeypox until all of your rash has healed, all of those lesions that Dr. Scott mentioned earlier. Really want to encourage people to talk to your healthcare provider if you have any questions, if you're doubting at all that you may have been exposed or that the rash or any other symptoms you're reporting may be monkeypox, and then to see a healthcare provider as soon as possible. And if you don't have a healthcare provider, we at the San Francisco AIDS Foundation or at Magnet specifically in the heart of the Castro and San Francisco City Clinic would welcome you to be evaluated further if you need some help. Next slide.
Thank you, Dr. Scott. Thank you, Jorge, for that presentation. We now want to move on to Dr. Susan Phillip from the San Francisco Department of Public Health. Dr. Phillip.
Thank you so much. And I think that my slides will come up shortly, I believe. Thank you so much for the opportunity to join in this really important discussion this evening. It has been so important and so wonderful to partner with the San Francisco AIDS Foundation in all of the amazing work that they've done to so quickly respond. And I want to talk a little bit about how SFDPH has also been trying to respond and support these efforts. Thank you to the 575 of you who are joining to talk about this important subject today with us. Next slide, please. So I won't spend time here. Dr. Scott really went through this really well, and you'll see that my numbers are less in some cases for worldwide and US even than his. So this is changing not just day by day, but hour by hour. And again, to emphasize, as he said, that this is not a new disease. It is the first time, though, that it is spread in so many countries at once. And so that is part of why we are really trying to reinforce the importance of response, of education to communities, as is happening this evening, and most especially of really mobilizing our vaccine efforts to get vaccine to as many people as could benefit from it. Next slide, please. So what has our US federal response been to vaccines? The demand for this vaccine, the Jynneos vaccine, is really high. There are 2 vaccines that can be used for the prevention of monkeypox, but the Jynneos vaccine of the 2 is the much easier one to tolerate as the person being vaccinated. It is also much easier to administer. Supplies of this Jynneos vaccine are extremely limited. The US Department of Health and Human Services, the federal agency, has announced distribution of 144,000 doses for states and jurisdictions. They announced that last week. They say that they anticipate 1.9 million doses for the remainder of this year and 2.2 million during the first half of 2023. We and SFDPH are working very closely with the state of California, who receives vaccines through this federal system. So the way it works is that the vaccines go from the federal stockpile to the state, the California Department of Public Health, and they allot it throughout the state. The city and county of Los Angeles receives vaccines directly from the federal government, so they are not included in California's allotment. Next slide, please. So for San Francisco, we have received a total of 2,888 doses. Most of these, the vast majority, almost all of them, came just last week. And so far, 95% of what we have gotten has gone out to clinics, but also to community organizations. And this week, we've requested an additional 35,000 doses immediately, as soon as possible, as a first step to get us on the path towards reaching anyone who needs a vaccine. Vaccines are the best way we have to protect people and stop the virus and from spreading. And so far, more than 1,000 San Franciscans have been vaccinated with a first dose. Next slide, please. So who is able to get vaccines in San Francisco? We know that this is a really important topic to people, and it's been causing people a lot of concern to see how limited the vaccine supply is in our city. We know at SFDPH that many gay men, trans persons, and other LGBTQ+ individuals, San Franciscans, need the protection that's offered by the monkeypox vaccine and should receive it. Because we have such limited vaccine supply, we are temporarily asking everyone to prioritize those who have had a direct exposure. And we really thank all the San Franciscans who have been taking care of each other and allowing people who have been exposed to go first until we have more vaccines available. We will let the community know as soon as we have more vaccines and can widen the group of people who can get them. And we're working towards our goal of having everyone who needs a vaccine being able to get one. Next slide, please. Health equity is incredibly important, and this is a big focus of our thinking through our response and how we allocate vaccines. We know that anyone can get monkeypox. It is spread through close contact and some face-to-face contact and spreading of respiratory droplets, and rarely through items such as clothing and bed sheets, as Dr. Scott said. But it is spreading fastest right now within the networks of gay, bisexual, and transgender people. This disease has nothing to do with sexual orientation and gender identity. This is really a function of networks. And we're looking at our data by race, ethnicity, and geographic location in the city to make sure that our vaccines are reaching people equitably. We're going to be focusing our work with community partners, within our own teams, and in our communications to the public to prioritize equity in vaccines, testing, and treatment, meaning that the communities and the smaller groups within the larger communities that are most impacted are able to access these prevention and treatment tools. And San Francisco will do this by building on the lessons learned from community during other infectious disease challenges that the city has weathered, including COVID and HIV. Next slide, please. So where is vaccine available? Again, very, very limited supplies. But currently, this includes the Foundation's clinic at Strutt, City Clinic, and other very select San Francisco Department of Public Health clinics. Kaiser is increasing supply for its patients, and there is a walk-in site at San Francisco General Hospital. We are continuing to expand locations when we have more vaccines. And ultimately, we want to have most healthcare systems and providers be able to access this vaccine. So we want this to be a routine vaccine that is routinely available to people when they want it, but we are far from that goal right now because of our limited supply. We also have a goal of making sure that people who are disconnected from healthcare or don't have health insurance can get a vaccine. So we have an updated list of vaccine locations that can be found at sf.gov/monkeypox. And we will continue to update information at that site, so people should follow it. The sites will run out of vaccine almost certainly until we are resupplied. And unless we are resupplied, we continue to ask the state daily for estimates as to when they anticipate getting more vaccine from the federal supply. We will get updates out to people and to our community partners through multiple channels of communication, including the website, social media, and communicating directly with our community partners and CBOs. Next slide, please. Okay, so vaccines are a really critical part, an essential part of stopping transmission of this virus. But there are also other important needs, as Dr. Scott and Jorge mentioned. Testing for people who develop symptoms such as a rash or sores has been far too limited because of lab capacity. And there's been a lot of administrative burden involved in getting tests done, which has meant that some providers haven't been able to do it. That is improving now with access from large commercial laboratories such as LabCorp. And we are also working to get our local public health lab on board to do testing for us as well in San Francisco. Treatment with an antiviral, tecovirimat, or sometimes called TPOXX, is also very limited right now. It's limited to a few providers because it is a new drug that is under investigation. It's not fully approved, and there requires a lot of paperwork. It requires a lot of paperwork to be able to administer it. So we're only able to do this in a few most serious cases and only through a few select health systems and sites. This is something that has to change. We need to have there be more streamlined access, and the federal government really needs to make this treatment more accessible to people who might need it. We are trying as much as we can to streamline the processes where we control them, secure more resources, and bring new ones online, including our own public health laboratory to do testing. And these areas of treatment and testing need advocacy and community voice too, in addition to the important area of vaccines. Next slide, please. So how people can help. We are all working through this together. And again, so valuable to have community partners, to have community advocates who are individuals, who are organizations. And we are going to have to work on this together collectively across San Francisco to keep people as safe as possible. But please be vigilant at summer festivals and large gatherings. Be aware of symptoms of monkeypox as you've just heard them described. Stay informed and spread the word about monkeypox and staying safer. And then for guidance and case counts, again, this site on SF.gov is a place to go for our city data as we are able to share it. Materials there. You can request a presentation to your community group by emailing us at this address listed here. And then please do follow us on Twitter, SF_DPH, for updates on vaccines and other news. We will be pushing out information as it's breaking there on Twitter, as well as, again, through our other channels as we are able. Next slide, please. Thank you all so much, and appreciate the opportunity and look forward to the questions and the discussion. Thank you.
Thank you so much, Dr. Phillip, for that important information. And now we're going to go to San Francisco AIDS Foundation Chief Executive Officer, Dr. Tyler TerMeer. Dr. TerMeer.
Thanks, Russell. In 1982, 40 years ago this year, San Francisco AIDS Foundation was formed by the community in a moment of crisis. Due to the initial failure in the federal public health response, it was community that had to rise up to support, educate, bring awareness, and to fight for access to the resources we needed and deserved. Now, I don't think we should ever draw a direct correlation between this moment and the beginning of the HIV epidemic. The story of HIV and that fight for life has its own crucially important yet complicated and tragic memoir, the scars of which will always remain a stain on American history. However, what we should note in this moment is the lack of urgency that once again exists when a public health crisis is impacting cis and trans men, as well as non-binary folks within the same social and sexual networks in our country. Leading into the last few weeks of June, the team here at San Francisco AIDS Foundation, in coordination with our community partners, as well as state and local public health, were discussing monkeypox. We were preparing our workforce, beginning to raise community awareness, and awaiting vaccine for what we knew could happen in our community in and around the Pride season. What we were unable to do based on the national shortage of Jynneos vaccine was begin vaccination. As you heard earlier, this week, as of this week, San Francisco AIDS Foundation has only received 290 doses of Jynneos vaccine and are anticipating 500 more by the end of the week. Yet, we have more than 2,000 eligible individuals on our waiting list for vaccine. To effectively respond, we would need more than 6,000 doses to vaccinate all those at high risk for monkeypox that visit Magnet, our sexual health clinic in the Castro, and thousands more to respond in the broader community. Harkening back to our earliest days, the foundation launched a hotline. Our monkeypox hotline now receives 1 to 2 calls per minute from community who have questions or believe they may have been exposed and are desperately seeking access to vaccine. Many callers are frightened. They've never heard of monkeypox before, and they have just received an email from an event producer saying they were exposed to monkeypox. Then the search for vaccine begins. Folks waiting in phone tree queues, relying on their social networks for information and standing in long lines, uncertain if they will truly result in a vaccine at the end of the day. I want to acknowledge that this stuff is scary. Regardless of whether it is fatal or not, things are scary when there are a lot of unknowns, when people don't know what they're supposed to do. We hear you, we see you, and San Francisco AIDS Foundation is here continuing to ring the alarm. Now, these small and inadequate allocations of vaccine make it nearly impossible, as you've heard tonight, to beat the curve of new infections, let alone lift up the vitally important conversations about vaccine equity in our community. The federal response has not only been a failure, but dangerous for cis and trans men, as well as non-binary folks that may have the same social and sexual networks. We have an imminent window to address monkeypox between what were our Pride events and the upcoming street festival season here in San Francisco, and that window is closing. We need to streamline access to testing and treatment, reducing any and all bureaucratic barriers, and we need vaccine in the hands of trusted community partners like San Francisco AIDS Foundation right now. So thank you for your patience with us in this complex and infuriatingly unimaginable situation. Thank you for continuing to show the world the resilience and power of community voice. And thank you to the over 2,000 of you who signed up on our wait list. The good news is that San Francisco Department of Health has allocated more vaccine to us this week, and we are organizing a vaccine clinic on Sunday to get as many of you vaccinated as we can. If you are on the wait list, we will be reaching out to you to schedule an appointment for Sunday. After Sunday, we will continue to make appointments as we have vaccine to give out. We share the urgency to get as many of you vaccinated as soon as feasible. 40 years ago, a phone rang in our first office in the Castro. We answered, and we've been stepping up to answer the call ever since.
Thank you, Dr. T. And now I want to turn it over to our Senior Community Mobilization Manager at San Francisco AIDS Foundation, Ande Stone. Ande.
Hi, everyone. My name is Ande Stone, Senior Community Mobilization Manager, and I want to share a little bit about some actions that you can take right now today to push our public health institutions and our elected officials at the federal level to do more around increasing access to essential treatment, prevention, and critical stores of vaccines. We are going to be fighting and encouraging folks to take action. Erin, could you please share our demands? Wonderful. It's extremely infuriating that our federal government has once again failed in their response, especially after a 2-year public health crisis like COVID-19. It is enraging that this is the response that we've seen after a 2-year public health crisis that shut down the nation. And we must demand more of those public health institutions and of our elected officials. That's why we are demanding that the Centers for Disease Control and Prevention, as well as the Department of Health and Human Services, immediately take the following actions. 1, increase access. The federal government must immediately increase vaccine supply and distribution through community-based organizations and other trusted healthcare providers. Access to testing and treatment must be expanded and streamlined at all levels. 2, ensure equity. Ensure that testing and vaccines are made available to all people who may be at risk of monkeypox, including gay, bisexual, and other men who have sex with men, sex workers, and trans and non-binary folks. We also must ensure equity in our response by ensuring that BIPOC community members who may be at risk are being prioritized. And lastly, we must continue to fight stigma around the monkeypox virus. We have to balance the need for population-specific messaging with non-stigmatizing, sex-positive health communication and public health response strategies. Next slide, please. Now, I'm going to encourage everyone to take action now. Join us in this fight. It requires us lifting up our voices and pushing our elected officials and our public health institutions and demanding accountability. You can do this today by texting Prevent Monkeypox to the number 52886. Join us in lifting up the demands that we just mentioned by adding your name to our petition. We will engage in additional advocacy as we learn more and continue to push our public health institutions and this failed response to be more responsive to the needs of communities most impacted. Thank you.
Thank you, Ande, for that call to action. We're now going to move to questions. We've received over 150 questions through the Q&A. But before we get to that, I just wanted to offer an apology on behalf of all of us for the problems with the Spanish translation. And so I'll say that in Spanish. Nos disculpamos sinceramente por los problemas con nuestra traducción de inglés a español con esta presentación. Esperemos hacer esta presentación en español muy pronto. In English, we apologize for the problems with the Spanish translation, and we will be producing another webinar in Spanish for folks to be able to access at a later date. Also, for the questions that you have been asking, we're going to be grouping those questions and responding to them on our website, in our monkeypox page, which is at sfaf.org/monkeypox. But now let's get to some questions that have come in. There have been some similar questions asked, so I will, with the help of my colleagues, group some of those. And so one of the things that we talked about was the vaccine. Jorge, Dr. Scott, one of the questions that has come in repeatedly is, how are you eligible for the vaccine, which you talked a little bit about already, but how do you get on the wait list? Can you address that again, please?
Yeah, sure. I can address both questions there. So first of all, how do you know if you're eligible? Essentially, if you've been notified that you are a contact to monkeypox, so if you've been informed by somebody, we'll leave it at that. It could be a partner, it could be a party venue that you've been at, it can be a healthcare provider, it could be a laboratory. Essentially, if you've been notified that you've been potentially exposed to monkeypox. That is what currently makes you eligible in San Francisco. As far as getting on the wait list, you can call us at the San Francisco AIDS Foundation over at Strut 415-581-1600. It's option 1. It gives you the information on how to sign up. I could also give you the actual link. That's sfaf.org/monkeypox, MONKEYPOX, VAX, VAX. So once again, sfaf.org/monkeypox, VAX. Anything you want to add to that, Dr. Scott?
No, that was spot on.
Some other questions are some of related to the practical, of living in San Francisco and participating in the community, going out to bars and clubs. For instance, Dory Alley is coming up at the end of the month. So there are a lot of questions around what should I do if I participate in those events, or if I go to dance parties, if I have a little clothing on. What are the precautions that I need to take to keep myself safe and to keep the folks I'm with safe as well?
I can maybe start with that. So, I think that it's about people doing having information about what they feel comfortable doing, knowing how monkeypox can be spread, and taking the precautions that they feel that they can take. So we know that it's spread through skin-to-skin contact, and it can be spread through bodily fluids, including things like kissing and those kinds of things. So having that information, and then people making decisions about what they feel comfortable doing when they're out at events. I think the other thing is, as much as possible, having conversations with any potential intimate partners around how they're feeling. The prodrome symptoms that occur, that is the infectious period, so that can happen before someone has a rash. So if you are not feeling well, staying home. And those are some of the things that we sort of try to give people guidance about. We're not telling people what to do and what not to do, but making sure that they have the information to make an informed decision.
Another question that got asked was, some people have received the first dose of the monkeypox vaccine, but their second dose isn't going to be for another 4 weeks. How protected are they with the first dose?
You want me to take that one, Dr. Scott? Yeah. So we know that by getting both vaccines separated by 4 weeks gives you the optimal response. But we also know that you get quite a bit of robust immune response after the first vaccine, after about 2 weeks. Now, I wouldn't say you're completely protected if you get the vaccine, the day before Dory Alley. Definitely want to spread out the vaccine before you're going to potentially get down on the dance floor. But we do know that for sure you'll have some response about 2 weeks after the first shot, with getting the full response after your second shot.
A question related around prevention is, during COVID, we were told to carry hand sanitizer, to use hand sanitizer all the time. Is that effective in preventing the spread of monkeypox?
So if you touch the lesions, they, that's how they're transmitted. So if somebody has an exposure to a rash, it's not clear that hand sanitizer alone immediately after will prevent someone from acquiring monkeypox. It is always a good idea to wash your hands and sanitize your hands. So, doing that as a potential harm reduction would make sense, but it's not clear that that's going to completely prevent someone from acquiring monkeypox if they've touched someone who has a lesion or has had contact with monkeypox.
Another question is, if someone has been infected, will they get reinfected again? Is it possible to get reinfected with monkeypox?
It doesn't seem, so when somebody acquires monkeypox, they have, unless they have some immune compromised state that doesn't allow it, they will have a antibody response that we believe would be protective from them acquiring monkeypox again. This is sort of what we've seen with smallpox and these other types of viruses that monkeypox is in the same family with. And it does wane, so that I know there's a question about if you have either received the smallpox vaccine or if you're over the age of 50 and received it a long time ago, are you still protected? And we have seen cases in older individuals who are acquiring monkeypox. So it does appear that over time that protection might go away. So it might not be lifelong, but it should be extended amount of time.
There's a group of questions, and this might be for Dr. Phillip as well. There's a group of questions around for folks who are producing large events where they're described in the question as touch events, where people are going to come into close contact with one another. What is the messaging that they should be saying to folks who are attending their events around monkeypox? Dr. Phillip, would you like to take that one?
Sure, happy to do that. And I just want to say that it's really wonderful that producers and people that are putting on the events are thinking about this and thinking about the health of the people that attend. So I really want to commend people for thinking this way. I think that as we just heard sort of expertly from Jorge and from Dr. Scott, we want to make sure that people have the information. So that might be pointing them to the foundation's website, to SF.gov, to our monkeypox site, or to other reputable sites that have good information so that people can understand how the virus is transmitted and then again, make decisions that are helpful for themselves. And if there can be an atmosphere where people feel comfortable reporting back if they do develop a case of monkeypox, then the organizers can, send out a notice and let people know. So if they have ways of thinking about how they would do that, that is also very helpful to be doing right now.
Thank you. Another question has to deal with asymptomatic spread. I think a lot of folks are familiar with that related to COVID, but can monkeypox be spread asymptomatically?
So when somebody acquires monkeypox, there is an incubation period before they develop symptoms. So the infectious period does start when symptoms start, but they can be very nonspecific, like fatigue. So if somebody has those symptoms, and they could potentially be infectious, but they might not think much about them. And if they do have symptoms, and we've seen this where people have these symptoms, test for COVID and it's negative, and then go about, their day. So that person is potentially infectious at that point, even though they don't have a rash, because usually the rash shows up after the prodrome symptoms.
Are there any interactions around being HIV positive and the monkeypox vaccine? There's a question related to vaccinating HIV positive folks.
Susan, do you want to take that one, or you want me to answer it?
Sure. I was going to defer to the expert clinicians here with those kinds of questions, but I will jump in and they will correct me if needed. But there's no contraindication to using the Jynneos vaccine. It has been studied in people living with HIV. It has been studied in people who have skin conditions such as atopic dermatitis. The reason that's important is that any conditions that might cause immune compromise or certain skin conditions, you can't use the other type of vaccine that is effective in preventing monkeypox or smallpox. But this vaccine, Jynneos, can be used. And we are having some of our clinics, like our Positive Health Program, Ward 86 clinic at San Francisco General, they are offering this to their patients who need it. So we do encourage people to get vaccinated.
Jorge, there was a question around how someone can participate in the CDC study that was mentioned in the town hall. Is there somewhere that you can point them to?
Oh, that's great. Great question. I would say come on down to Magnet. And if you're a client of ours, we'll get you registered, and just make sure to mention that to our service navigation team. and they'll be happy to direct you to our clinic research assistant, Ricky, who can get you signed up and ready to go. It's a really easy consent that you need to kind of go through, quick questionnaire, and an extra tube of blood that we draw from you. So yeah, that'd be a great way to have you come on down.
Great, thank you. Another question about risk reduction and behavior, which is if folks are going to be out, how do they, if they see someone, the question is really around, if they observe someone that they don't know what it is, it could be acne, it could be something else related to that. Is there what should they do, right? I get the question is really about how do you don't want to stigmatize someone because they may just be broken out. They might have a skin condition. What words of advice do you have for how folks interact in that way?
Jorge or Dr. Scott, I'll defer to you.
I'm happy to take a stab at that one. So, I think you want to be respectful, and I think lead with that. And depending on the situation, in general, if you don't feel like you can respectfully say something to somebody, it would probably be best to respectfully not. And whether or not you let that person know that they may have something that they may or may not be aware of will depend on the situation. So it's not a hard and fast answer to that question, but I think we do want to be respectful of people in our community, understanding that it might not be monkeypox, that it might be some other skin condition, and don't go out of your way to ruin someone's day.
Thank you for that, Dr. Scott. On the screen is something from Andy's presentation around what you can do to take action around preventing monkeypox, and that is to text prevent monkeypox to the number 52886. That will give you information on how to advocate for more vaccine. Dr. Phillip, you said that we're today at the press conference. Dr. Grant Colfax, the Director of Public Health in San Francisco, advocated for asking the state and the federal government for 35,000 doses for San Francisco. What are other ways that folks can kind of apply pressure to the federal government to advocate for more doses for San Francisco?
Well, I think partnering with the foundation is really important, and also really making sure that elected officials at the federal level understand how important this is to San Franciscans. And I know that they are hearing it, but it is really important to be speaking. We're speaking through our public health channels, and we know that people have really strong voices and strong advocacy histories and abilities here in San Francisco. So all of us together speaking in one voice will be the most effective route.
Great, thank you. And then Dr. Scott or Jorge, there are several questions around transmission related to objects. Sitting, like if for instance, if they're at Lazy Bear Weekend in Guerneville, which is coming up soon, and someone sits on a lounge chair and has exposed skin, and then gets up and walks away, and somebody else comes and sits down on it. What are the risks around transmission related to that?
So I can add a little bit to that. We do know that although there is some potential for exposure through fomites, so that's in contact with materials that people are exchanging, like towels, chairs, as you mentioned in your example, it is a lot less potential risk. So there is definitely there is potential. It's a lot lower than being directly in contact with somebody who has lesions, skin-to-skin contact, and again, exchanging bodily fluids, as we mentioned, kissing, etc. So that's really the higher risk. I think sitting in or sharing a chair is less worrisome.
And then related to that, Jorge, Dr. Scott, there's some questions actually about practical things like laundry. So should folks be doing anything different in terms of sanitizing their laundry, their towels, their linens, etc.?
I think maybe just to carry on from the previous question, so maybe just to clarify, I think if we're sharing apartments or sharing maybe, washing machines, maybe best, if there's a question within roommates or whatnot, to maybe separate laundry and not wash with other people that you're concerned about potential exposure. If the question is, like, if I go to a laundromat and I'm, washing my clothes in a shared public laundromat, there's not really, again, going back to my previous comments around that, where the real high risk exposures are. I think less concern about using a public washing machine or dryer.
We're at time, but if we could just answer a few more questions for the panelists, and then we'll wrap up, because there are literally over now 200 questions that have come in. One of the questions is, like, what should we expect if we don't have this vaccine coming in the supplies that we need it? Will we see a really big outbreak as bigger public events are coming up? Like, what level of worry? Really, I think this question is these series of questions around how much people should be worried about their own exposure because we don't have readily available access to a vaccine supply.
This is something that we're thinking about all the time at DPH. We really do want to protect as many people's health as possible and provide services for people that currently have monkeypox. I don't have the answer to that question about what the trajectory might be, but we do know how it spreads. We do know that the vaccines can be preventative. If we don't fully have the vaccines, I think that the important thing to remember is that as a city, as communities, we still do have the power to protect ourselves and to protect people around us by thinking about the way that it transmits, and then taking that information into account, including what's the availability of vaccines right now. So I don't know what it'll be next week or the week after, and we may have to, come back together and rethink, collectively, figuratively, come back together and think about, like, what does this mean now for what we might need to do collectively in San Francisco? And we're going to be sharing our thoughts, and I know that the experts at the San Francisco AIDS Foundation will be sharing their thoughts as well. We are going to be in communication with them and with many other people. So all together, we will be thinking about what might the trajectory be. But I think that that's a really important question, and one that we're going to be following really closely.
Well, and related to that, there's been some questions about testing, because there appears to be some confusion around, like, for instance, I got a notification that I was at an event that I had an exposure. I've had no symptoms, or none of the symptoms that all of you have described. But I don't know if I should come in for testing or not. And so there have been several questions around, do I need to have symptoms? Do I need to have lesions in order to be tested?
Yeah, that's a really fantastic question. So right now, yes, the tests that we have available work on trying to amplify the materials that are in lesions. So that is necessary to develop the lesion. So that's why one of the first steps after being told that people are exposed, to find vaccine, but also to watch really closely to see if any symptoms might be developing. And then also to recognize that the symptoms might be kind of mild or atypical. So really being cautious about that. But yes, it does require lesions at this time to do a test.
And then I think as we come to a close, Dr. Scott and Jorge, I think it would be great to remind folks what it is that they're looking for around symptoms. We talked a little bit about that earlier, but I think it would be good to come back to that as we draw to a close. What should folks who either have been exposed or they know they were at a large event where there were folks who had monkeypox, how should people be monitoring their bodies to know that in case they were exposed, what they should be looking for?
I could take that one. So I think that, the initial phase, and this is always what's challenging, is because the initial prodrome or beginning symptoms before we actually see something on our body is very similar to, say, COVID or the flu or the common cold. So things like just fatigue, kind of body aches, flu-like symptoms. So, maybe feeling like you're going to start developing a cold. So that's essentially what starts kind of at the beginning. The more, the symptom that you could see readily often in most cases are these lesions. So it's a rash that kind of starts off as typically kind of reddened, like just kind of rashy red area, red patch on your skin, but quickly evolves and develops into very similar to like a blister, or some people think of it maybe as like a big zit. Looks kind of like a whitehead, not always, but very commonly, and they can be of varying sizes. So they don't have to be the large, blisters that you might be seeing on some of the websites. At Magnet, we've seen them. They look, in some cases, very small. They can be scattered all over the place, often around the genitals or the anal area. But I've seen them also on people's necks, on people's chests. And so it's really looking out for those characteristic kind of blisters that, you know your body is better than anybody else. So just think about what's normal for you to see on your body. And if you're noticing something like that popping up somewhere that you're not used to seeing that pop up, then that should raise some concern and alarm.
Thank you, Jorge. Thank you, Dr. Scott. Thank you, Dr. Phillip. I just want to put the slide up one more time because we could use your help in advocating for more vaccine for folks in San Francisco. Please text Prevent Monkeypox to the number 52886. You'll get instructions on how to advocate at the federal level for more vaccine for San Francisco. I want to again thank our panelists and direct you to information that is available both at sf.gov/monkeypox or on the San Francisco AIDS Foundation website, which is sfaf.org/monkeypox. We will be taking the questions that were submitted today and responding to them on our website, again at sfaf.org/monkeypox. We have recorded this presentation, and the recording will be available on our website. Again, thank you to the panelists for joining us this evening, and thank you to all of you for joining us this evening for our virtual town hall.